Okay. Now, as the founder of Nigeria Health, Mental Health rather, what is your organization doing to reduce the prevalence of cases, health cases we record from mental health disorders?
Well, thank you for asking that question. Nigerian mental health really focuses on four areas. One is policy. The second one is education and research. The third one is disability inclusion, and the fourth one is wellness programming. So,
Okay.
right now we're doing especially a lot of work in the policy advocacy category. We helped lead actors and support initiatives with others to get the Mental Health Act passed. That was done around 2 years ago. And we've supported other things around policy reform. We helped author two national strategies on mental health. One is the first, Nigeria's first ever suicide prevention strategy, which is important. I talked about how Nigeria has one of the seventh largest suicide rates on the continent and the 15th largest in the world. And so we're now one of less than 10 countries in Africa that have a suicide prevention policy. We helped author a new mental health strategy for the country. And the mental health strategy for the country is after a decade of silence. Now we're help pushing a roadmap for the Mental Health Act and making sure that gets implemented. Another important thing we're doing is that now that we have a Mental Health Act, we can't help individuals get help seeking behavior because suicide in the country is currently criminalized. So attempted suicide is criminalized. So unfortunately, if somebody tries to take their life, instead of getting the help and support they need, it is according to the Nigeria's criminal and penal code, they are sentenced to up to a year in jail. The World Health Organization says that stops help seeking behavior, which is antithetical to the Mental Health Act. So we are pushing, now that we got the Mental Health Act passed, we are pushing for the Mental Health Act to have a creation of a department of mental health, which is one of the institutions. You can't make sure that all the things around training or human rights or funding happen if you don't have a standalone department of mental health. So we're calling on the federal government to make sure that we execute the Mental Health Act and create a department of mental health. More than 2 years, we haven't seen that happen. And it's one of the things that's in the law that needs to be enforced. But also, we're also calling on the federal government to make sure that they decriminalize attempted suicide. We've been working with the Attorney General's office, the Federal Ministry of Health, and also the National Assembly to pass a suicide prevention bill. We need the National Assembly to act on it this year so people really, so we can become one of the, we're only one of less than 20 countries that still have suicide criminalized on the books. It's a colonial area law. And if we decriminalize attempted suicide, it will help enact the gains of the Mental Health Act and give people the support they need as opposed to landing them in jail.